Hey guys, um, sorry, I fell asleep last night while I was waiting for the other video to load. So here is the test review. I want you to kind of go over and know the types of behaviors that are associated with poor health literacy. I think you guys kind of got that pretty down pretty well. Your assignments were very good. So just remember, it's these patients that can't comprehend instructions. They avoid any teaching. Oh, I'll have my daughter talk to me about that later. And they can't complete the health forms. They don't understand what the directions on like medications. So make sure you are understanding the importance of documenting the teaching process. I will say that I did have a patient who people were doing teaching, but it wasn't being documented. So when Medicare came to say, okay, why is he ready for discharge, there was nothing in his chart that said that he had gotten diabetic teaching or anything like that. So they were actually not going to cover the cost of his stay. Review the cultural differences, the different factors that will affect learning. It could be cultural stuff. Make sure you know their psychomotor ability. Repetition, repetition, repetition. Their timing, the environment, the emotions, the events they got going on. Relevance. Is it relevant to the patient at the time? Are you giving them feedback? Very, very important to be non-judgmental. Start at the beginning blocks and build up on what they already know. Make sure it's appropriate for their age and their developmental stage. Assess if they're motivated and if they're ready to learn, and get them actively involved. Know your different learnings, the affective, definitely the feeling level, when a person accepts that they have a new disease. Cognitive is the thinking, and so they're actually understanding the fact. Sorry. And then the psychomotor, where they're actually able to carry it out. Know your teaching process, just like the nursing process. I know I'm kind of going through this kind of fast, guys. The assessment, the diagnosis, the plan, what you're doing, and then did it work, your evaluation. Know your learning theories, the behaviorism, the cognitivism, and the humanism. Yeah, make sure they're ready to learn, make sure they're motivated, and make sure they're able to learn. Otherwise, you will be wasting your time trying to teach them. So that is pretty much the Unit 1. Kind of breaks it down a little bit of what you guys should look over. Unit 2, know your signs of pregnancy. What are subjective and presumptive? What are objective and probable? And what's positive or diagnostic? Know what sign or symptom is in each of these categories. Know your definitions. Gravida is any pregnancy, no matter how long it is, including the present pregnancy, so how many times they've been pregnant. Para is any birth after 20 weeks, whether the baby is stillborn or born alive. Nulla gravida, never been pregnant. Prima gravida, pregnant for the first time. Multigravida, second or more. Nullipara, never had a birth at more than 20 weeks. Primipara, one birth after 20 weeks. And multipara, two births or more after 20 weeks. Yeah, so review all those definitions there. Psychological anemia, also called pseudoanemia. When you look at the blood work, it looks like the hematocrit is actually decreasing, but it's basically staying the same, and the amount of blood and plasma is increasing. Because remember, mom will have a 40 to 50% increase in blood amount. So know your the changes in the pelvic organs. I just put the definitions in here. The Goodell sign is basically the softening of the cervix that occurs with pregnancy. The Chadwick sign is that bluish-purple discoloration that we talked about, where the cervix and the vagina and the vulva. Hold on, my phone's ringing. Hey guys, sorry, I'm back. Just more people calling and checking on my brother. I was wondering why my phone was ringing and this early, but it was just more people checking. My life's a little busy. Alright, back to the changes in the pelvic organs. We'll just start with this one. The Goodell sign, the cervix starts to soften during pregnancy. The Chadwick sign, like I said, is that discoloration, which is like the blue-purple of the membranes of the vagina, the cervix, and the vulva. Hagar sign, basically the isthmus of the uterus, is softening. And then the McDonald sign, where that uterus is actually not as flexed back. Because once you, if you ever check somebody in labor, their uterus that you feel is really, really, it's far back. It's kind of hard to explain without showing you, but it's up and back. So pregnancy kind of brings that, the body of the uterus down. Review the increased urination, especially during first and third trimesters. Teenage pregnancy and the risks. Why? I know we didn't go over this a whole lot in the PowerPoint, but think about why these teenagers that are having babies, what happens? As a teenager has a baby, they are forced to grow up rather quickly, and they don't get to do the normal developmental stages. Example, the young girl who gets pregnant her senior year. If she had plans to go to a 4-year college and she's going to keep the baby, that kind of runs into, okay, what are my other options? Well, 4-year college and living in a dorm room and all of that is kind of a rite of passage of growing up. Well, if she's got a baby, she may have to change her thoughts into going to a 2-year for now, and then going back later in life. So it just kind of, they're not hitting all the developmental milestones that normal teenager, normal early adults get. Review the cardiac parts of labor or pregnancy. Remember that mom's blood volume increases and can cause higher blood pressures. It can cause higher pulses. Yeah, just review that part. Supine hypotensive syndrome. Sorry, on top of everything else, I think I'm starting to get sick. Remember, this is when that uterus, when they lay flat on their back and their uterus kind of, it presses on the vena cava. So if you have them lay on their side, it will help reduce the symptoms. because what it's doing is just causing lower blood pressure because the blood flow isn't going back to the right atrium. Know your phases and stages of labor. Remember that the first stage is basically the dilating phase. The latent phase is the 1 to 3. The active phase is the 4 to 7. And the transition phase is the 8 to 10. Second stage is anywhere from full dilation to the birth of the baby. So just think the pushing stage. And third stage is the placenta, when the placenta is expelled. Review normal weight gain during pregnancy. Normal weight gain 25 to 35 pounds. If mom's overweight before pregnancy, 15 to 25. And if she's obese, which is a BMI of 40 or greater, they're recommended only to gain 11 to 20 pounds. But if mom is underweight, they actually recommend them to gain up to 40 pounds. Review, and I'll kind of put it up here. Review education during each trimester. What things do we need to teach moms and dads during each trimester? Because remember, going back to the first unit, if it's not relevant, they don't learn. So anything during first trimester is like, what helps relieve some of the discomforts of the early pregnancy, the nausea, the vomiting. They're going to be choosing a care provider. They're going to need to know about things that are going to be harmful for the baby in that stage. They're going to need to know signs of, if they miscarry. And they're going to need to know, things they need to do to take care of themselves. In the second trimester, big thing is if they're planning to breastfeed, kind of getting them some information on that. Again, later pregnancy discomfort. And a good one to touch on during second trimester is sexuality during pregnancy, just because that's a really common fear of dads, is that they're going to hurt the baby when they're having sex. So then, education in the third trimester, they're basically preparing for childbirth. This is where they may develop their birth plan, learn some relaxation techniques, or like Lamaze breathing, giving them information on how to take care of themselves after baby, and then getting some information on how to take care of baby. Know what the decels of the fetal heart rate mean. Remember the veal chop that I said in the lecture? You really just need to determine where the deceleration is. Any decels that are uniform are benign. Just monitor them. Late decels generally show a symptom of if there's not enough blood flow to in the placenta, and then decels that are just popping up here and there basically mean that the cord's being compressed, and that may be just that the cord fell between the vaginal opening and the baby's head, and every time the baby drops down or a contraction, it presses on that cord. Remember, mom's got increased cardiac output during labor. She's got increased oxygen demands. Review the pain management during labor and phases of labor. I kind of remember I went over this. last night in the lecture. Know when to give pain meds, know when to do non-farm measures. Um, generally, pain meds are given during the first stage active phase when mom is dilated 4 to 6, just because up until that point you can use different things to kind of relieve pain, whether it's hot tubs or whatever. Leopold's maneuver. Um, remember, this is where mom comes in labor and you're just going to check and see the position of the baby. Epidural. Huge risk for hypotension. So remember, we need to help them empty their bladder before we administer it. Sometimes, I forget what the criteria are. I can't remember them. I haven't hardly slept in the past 2 days. They may insert a catheter, and then we just need to really, really watch their blood pressure. The bolus should help with that, but still need to keep a very close eye on it. Spinal advantages versus disadvantages. Just know that the spinals are, epidural is done more common, but the spinals can be not an emergency because that would be general anesthesia, but when they need to get the baby out quicker. So, I don't know if I'd really call it easy to administer, but it's a lot quicker than doing an epidural. Review the pain medications, the Nubains, the Stadols, the fentanyl. Know when to give it. Remember last night I said that you do not want to give Nubain anytime after 8 centimeters, 8-9 centimeters, just because it'll cross into the baby, and you'll see a lot of respiratory distress in the baby. Oxytocin. Remember, this actually can stimulate labor, because it causes contractions of the uterus. And it helps that uterus continue to contract so that those vessels are closed off, so that mom isn't bleeding. Oxytocin can be actually released when baby starts nursing. Mom will release her own oxytocin, which is why it's the next unit or so, but which is why when mom breastfeeds, she's going to have some cramping. Immediate interventions when the water breaks, because it may happen, whether you're checking them to see how far they're dilated. So always make sure you know what time, the color, the amount, odor consistency. I will tell you that I did have a mom who did not have any documented STIs, and when her water broke, it was it was green and purulent, and I don't remember what she had, but the infection had entered into the amniotic fluid, and the baby ended up being transferred up to Gunderson. Review true labor versus false labor. Basically, the Braxton Hicks contractions are irregular. They slow down and stop with walking and activity, whereas real contractions will become more intense and more frequent. Review the fetal positions. Remember, the attitude is the baby's parts related to each other. Fetal lie is how the baby's laying in mom's belly, whether it's longitudinal or transverse. Review the presentation. Cephalic, vertex is basically the head's flexed onto the chest. Sinciput, the head is neutral, so it's the top, or the occipital-frontal, the brow, the face. We went over those. Review what breech presentation means and the shoulder presentation. The right or left is basically what side of the pelvis is the baby on. Yeah, I'm just kind of trying not to completely repeat what I did last night. Know the landmark of the presenting part. For O for occiput is basically the head. M for mentum is the face. Sacrum, S is the butt. And A is the shoulder. Know where that baby's positioned, whether they're anterior, posterior, or transverse. Review the RH positive and RH negative. And I don't know if I went into this last night. I'll give you a quick rundown, but feel free to email me and ask questions. If mom is RH negative and dad is RH positive, that baby is more than likely going to be RH positive. And if it's mom's first baby, the pregnant baby can be RH positive, mom is RH negative. When that baby's born, that blood actually mixes, and mom starts to form antibodies to the RH positive baby blood. So, okay, fast forward to second pregnancy, early stages. Mom's RH negative, dad's RH positive. When the baby is in the very, very beginning stages, mom's body is going to recognize that because she's built up antibodies to it. It's going to recognize that baby as a threat, and the RH antibodies are going to attack the baby. So, mom's given RhoGAM, I think 28 weeks, and then right after delivery. I went over last night pushing before mom is fully dilated. Know your contraction definitions, duration and frequency. Know the nursing interventions for each stage. You're not going to want to just drop the soda. Try and teach them anything about infant care while they're pushing. So just make sure your interventions are appropriate for this stage in labor and delivery. And that's pretty much it. Between what I went over in depth last night and this, I usually don't put up the actual written thing, but it's very early in the morning and my hair's all over the place. You guys probably don't want to look at me. So if you guys have any questions, just let me know. Like I said, I'll be at my computer today. I'll have it out. I hope this really gives you an idea of areas to review. And like I said, if you have any questions, please get a hold of me. And alright, well, good luck on Monday. And I hope you guys saw my announcement that you can test at the campus, but we still need to use Respondus and the monitor. So I will call Boston today. Alright, have a good one, guys.